medical ethics and the legal side of a medicine. And honestly, I was actually surprised when I saw this topic in your curriculum, because it's a topic for for medical students and for doctors. But for MPH students, and maybe the ethics that actually would have been more applicable to you is actually probably research ethics. But the ethics that the curriculum has is a medical ethics, and for us to deliver the curriculum, I am actually covering medical ethics today, and the legal aspects of medical practice. Okay, very briefly. Which means it might actually be of immediate in a practical use to doctors like Ibitoye. Okay, and then for those of us who are public health practitioners, and it is good actually for you to know that, look, these are the ethics that, yes, all actually doctors vowed to uphold as they entered into the medical profession. So I'm actually saying that to ask you to actually forgive me if you feel this isn't relevant to your public health practice. But I still have to do it because it is in your curriculum for the second semester. Okay, so now let me just share my slides and we shoot and we go on. Okay, so the topic itself is called ethical and legal and considerations in medical practice. Okay, so yeah, okay, and therefore let us talk about ethics. Ethics has a widespread application across all disciplines. Okay, therefore, in fact, even though we are talking about medical ethics, but we have actually ethics, as applies to uh, every profession, because ethics outlines values that guide the conduct. Ethics determine what is right and what is wrong. Ethics determines what is good, what is bad. Ethics determines what is proper and improper professional conduct. So ethics, therefore, generally, they can be defined as a set of systematic rules or principles that actually govern the right or proper professional conduct. And each practitioner in whatever profession, upon entering that particular profession, you have the responsibility to uphold the ethics of your profession. If you are a journalist, there are professional and ethics. Lawyers, there are ethics. Doctors, there are ethics. Public health practitioners, there are also ethics. And these ethics become standards, benchmarks on which your work is judged or tried in court if you are involved in, and if you break any of these ethical standards, and actually you can be tried in court for malpractice, and at times you can be jailed. For doctors, if because of your own malpractice, a patient dies, depending on the law of the land, you can either be sent or to be given a life sentence, or in fact, if it's in a country the way they practice a life for a life, if a patient dies because you did not adhere to the medical ethics we will cover in the lecture, you might be killed for the life that you have taken. And I always say this because it is important that you listen. When we talk about ethics in class, okay, ethics. So they are the standards that guide practice and by which professional conduct is judged. Okay, so why do we have ethics? Why do we have professional standards? Why do we have professional code of conduct? Why don't we just let every doctor, every professional practice his or her own professions the way he likes, the way he deems fit? Well, you'll be surprised that, look, that was how it was before. Before Hippocrates started talking about ethics in the medicine, doctors they were actually practicing like the native, if the doctors do now within their own community. There are native doctors there. Nobody tells them how to practice their art. The native doctors, they do all the sorts of things. And they take advantage of they have to take advantage of the vulnerability of the people in the community who actually consult them. They can say, they can act anything unless they actually involved in a human sacrifice before the police starts to actually search for them. Medical practice was once like that. So where we do not have the ethics, what we have is actually confusion. Where actually what we will have, you won't be able to actually define what is actually moral and what is not. You won't be able to judge how human behavior determine practice. if there are no ethics. And it is a good thing and for you to know that, yes, why actually ethics is part of your course in MPH is that the medical ethics is a branch of healthcare management, which is what health policy and management is all about. And so that we are the ones who make policies that the doctors must follow, in the ethical conduct and behavior in their practice. Okay, so that is and I believe that is why it is in this course. So ethics in a medicine, therefore, sets out professional values, professional standards that guide proper the proper conduct of how doctors make the right moral decisions in all stages of their patient care process. So now so this is a proper definition of a medical ethics. So if we talk about the process of medical care, those of us who are doctors, those of us who are close to doctors, we will know that generally this is the general process of the patient care by doctors. Doctors consult patients when they come to the hospital to see them for the first time. And then in the first time, and during subsequent visits, they conduct physical medical examinations. Because they need more information to add to the data that they collected during the consultation, during the verbal history taking. Okay, well, what we call clerking. During consultation, you ask questions and you collect the patient's understanding of his or her disease condition before you now go on to now conduct physical examination of the patient's body. Okay, and then the evidence from your history taking, the evidence from the physical examination will now help the doctor to know what further investigations he needs to be able to make a diagnosis. Okay, so those investigations include a number of tests, biomedical tests, radiological tests, and tests of all kinds. So at the end of the day, the doctor is expected to make a firm diagnosis. So the doctor does not treat until he has made a diagnosis. Okay, the doctor should not treat until he makes a proper diagnosis. Okay, and then he must give the treatment that is applicable to the diagnosis he has made. If a doctor cannot diagnose or cannot treat, he is expected ethically to refer. No doctor should prescribe a treatment for a patient's condition he or she has not properly diagnosed. If you can't diagnose it, you refer. Even if you actually diagnose it, but you cannot treat it, you refer to, to the other doctors who can diagnose and treat. So after a patient is actually treated, a doctor is expected to discharge the patient from his care. No, either you actually discharge that patient home if no as already fully cured, or that you actually discharge from care to be followed up by the community health practitioners, people who go on to visit the patients at home, to continue treatment or to continue his recovery at home. And at times, and the patient is actually discharged from the health center and the hospitals, to go to care homes, or or, or to the nursing homes, where he can actually continue to receive tender and loving care that will assist with his or her full recovery. And then, if the ultimate happens, if the patient does not get well, the doctor comes in again to actually determine the cause of death and to actually issue a medical certificate of death. And at times, before he can do that, he needs to do a post-mortem, a review of the cause of death. So I have actually summarized here, a complete process, of of a patient care. So ethical standards, ethics, there is a code of conduct as to how a doctor should properly relate with his or her patient at every stage of this patient care process. And it is therefore, so just as I said before the Greek, the ancient and Greek doctor called Hippocrates, came up with a code of conduct that every doctor still swears today. Every doctor, before he or she is inducted into the medical practice, must swear that he will abide by the Hippocratic oath. Okay? And it is just good for us to know that look, for doctors, there is this oath. I don't know whether there is this, whether the other professionals, lawyers, probably lawyers also do, when they are actually passing out of the law school. Okay, that particular ceremony they attend, and maybe they also swear oaths when they are being inducted into the legal practice. Okay, but this Hippocratic oath is what every doctor must swear, and the Hippocratic oath has 6 key issues that every doctor swears to abide by. So, and so that, okay, so, and so that, no, so these are what we call ethical principles that should guide medical practice. All of us, you know, I uh, I graduated myself as a uh, uh, as, as a medical doctor exactly 40 years ago, in the 1986, from the University of Ibadan. And just as I talk about the 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 Hippocratic Oath, I actually remember how we're all told to stand. We were given these oaths to read out and then to agree to abide by it. The first principle in the Hippocratic Oath is the principle of the principle of beneficence. Beneficence means that, look, we actually say that every action we will take in our dealings with a patient is to do what will benefit the patient, that we will act in the best interest of our patients. Okay, so that is so do only what will benefit. The way we consult, the way we examine, the investigations, the way we treat, the way we actually manage in the ward, the way everything, the treatment, the drugs, the first principle we are assigned to is that whatever we do will be in the best interest of the patient, that we will prioritize the patient's well-being and health above our own crave for profit. Very many doctors today, what they consider first when they see patients is what they can gain. By that, they are breaking this particular principle of principle of a beneficence. Okay. This second principle is the opposite of the first. Okay. No. So the first one says, do everything for the benefit of your patient. Non-maleficence means that whatever we do, we should never cause harm to a patient. If you know that you can't manage in a patient without causing harm, then don't do it. Yes, very, very often, any treatment that you give, particularly surgery, you need, and in fact, even drugs as well, you need to always weigh the benefit of that treatment against the harm that it might cause. Every surgery leaves a scar on the patient's body. Okay, but then you have to go cut in, okay, and to remove the disease in the organ, or to replace it, so that if the benefit of that surgery outweighs the post-operative scars, then you go ahead and you book the patient for surgery. Every drug has side effects. So you never prescribe any drug that could kill a patient. Many cancer drugs usually have adverse effects. They lose hair, their skin, and at the beginning it affects their health, and particularly chemotherapy or radiotherapy. Okay, so they have adverse effect. Every drug has adverse effect, but the principle of non maleficence means that you must, as a principle, strive to do your patient no harm at all. And if you must give a particular treatment, the benefit of that treatment must outweigh the potential harm. The third other principle that every doctor assigns to is the principle of patient autonomy. That look, every patient has the right, if they still have the capacity to make decisions for themselves, they have the right to decide what happens to their body. Okay, so that is their autonomy. They have the right to decide what you do with the information that you collected from them about their body. Okay, so they have a right to make informed on the decision. Therefore, if a patient does not consent to the way you want to actually examine him or her, you cannot touch the body. Therefore, over here in the UK, a doctor must always ask the patient, can I examine your lungs? Can I examine your abdomen? Can I? Always use can I, because you want the patient to give you consent to touch his or her body. And that is based on the principle of autonomy. Okay, so the fourth principle in the Hippocratic Oath is the principle of justice. That look, every doctor must treat all patients fairly without discrimination. Okay, yes, it is. So the care that you provide must be equitable, which means you give the size of care that match the size of a patient's health problem. That is equity. And you do not discriminate on the ground of color, race, religion, or origin. Okay? Yes, we know that actually malpractices happen. The way we actually manage people who speaks our language is often different from the way we treat people who actually visit us in our clinics, and we recognize they have come from our backyard. It is unethical for you to treat patients differently according to who they are, what they are, where they come from. Okay, or actually how rich or poor they are. So all doctors have signed to treat all patients fairly, and that is according to to, to the principle of justice. So yes, so and then there is the fact also of a confidentiality. Okay, that look, all doctors are bound by this code to keep patients' information confidential. Again, unless they have given you the authority for you to share their information. Okay, we have had cases of of wives, you know, who who have actually given, their children, who have actually given their husbands, children that are that do not biologically, belong to them. And it is possible that the doctors have the DNA information as as to which child belongs to the husband and which child does not belong to the husband. And you can tell from a from their from from their genetic and the testing and the DNA, blood, blood group, their uh, their 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 their, their, their hemoglobin genotype, and all that, so that when you do blood tests on the children of a parents, it very very often comes up the discovery that look, this child does not belong to this mother or no father. A doctor is bound by the Hippocratic oath to keep his mouth sealed. You use that information to manage the child or the woman, but you have no right to actually divulge it to the public or to the father or to the parents. No, unless the patient gives you uh, uh, gives you the permission for you to do so. So, therefore, the confidentiality principle is a very, very strong one. Then the sixth principle in the Hippocratic Oath is the principle of a professionalism. That look, in whatever you do, you should be professional about your behavior. And these actually borders on you being honest. These borders on your integrity. These borders on you being accountable for your actions. Be professional be professional in your relationship. Do not cross professional boundaries. Okay? Don't cross the professional boundaries. Don't. Your relationship with every patient should never go beyond doctor patient and a relationship. Whatever you do, don't say, wow, this lady is so beautiful, oh, I will want her to actually be my girlfriend. You are crossing the boundary of a professionalism. You simply cannot do it because of the Hippocratic oath that you swore. So people have, so the oath has changed over time. and therefore people have actually reduced these particular principles from 6 to 4 core principles. Okay? And the principle of a justice, that you must treat patients fairly, without treat them fairly, treat them equally, treat them equitably, without discrimination. The principle of a beneficence, in whatever you do, do what will benefit the patient and provide care in the patient's best interest. 4, which is the very, very big one, the one of you must respect the patient's autonomy. Respect their right to decide what they consider best for them. And therefore, they need to give informed consent. Therefore, you need to keep their data confidential unless they give you the permission for you to share. And then that autonomy is that you must be professional in the way you relate with them. Okay, all that, well, yeah, all that, are all grouped under their autonomy. The fact that they have a right to decide what is best for them and what you can do or not do with their body or their minds. And then the other one of non-maleficence, whatever you do, cause no harm. And always, when you see that the harm outweighs the expected benefit, then you don't do it. Any treatment that would cause injury, disability, or death, you do not do it. So these are the 4 core principles that the Hippocratic Art has been reduced to. So this just shows what I actually said before. Okay, in a treatment and the beneficence, treatment, non-maleficence, patient autonomy, and service justice. But you can, as I said before, expand an autonomy and to include consent, data confidentiality, professionalism, and of course their right to make decisions. So concerning autonomy, in a court that's in America, the USA says every human being of adult years, okay, and sound in mind, has a right to determine what shall be done with his own body. So I actually picked this up because it is so central to medical ethics. If a patient has not given you consent for you to do surgery, to take a part, to remove a part of his body, no doctor has the right to wheel that patient into the theater. Okay, so unless the patient, if he is an adult, if he's a child, then you must respect the rights that the parents or the guardians have over the body of their children. So this is very, very vital. Then now, and we're talking about, at the professional boundaries, talking about professionalism. Ethics set professional boundaries in a doctor's dealings, in a doctor's relationship with patient and fellow physicians and the community. And these professional ethics or these professional boundaries, they are lines, moral lines that must never be crossed. Okay? If you cross these ethical lines, that actually determine your professionalism, uh, your medical registration is put at risk, because your registration to practice medicine can be cancelled by the professional and body in your country. And in Nigeria, it is the MDCN. Okay, they are the ones that actually register doctors, and they give them the registration as well as the license to practice medicine in Nigeria. So any doctor that has crossed the professional lines can be reported and be investigated by MDCN, Medical and Dental Council of Nigeria. And if they find the medical practitioner guilty, he may receive probably a warning if it is a mild offense, or if it is an extremely severe effect. Okay, they can seize the medical license, cancel his or her registration, and be sent to jail. That is why ethics education is vital for every medical professional. So there are some important and ethical issues that have actually come out in the modern times. Okay, ethical issues that have caused actually debate. Okay, one, there is the issue and the question as to whether whether a patient has a right to die, a right to ask a doctor, please give me an injection that will end my life. This pain and the suffering from this disease is too much. These are cases of people passing through cancer, and the suffering, pain, and the sleeplessness, or actually epilepsy. An epilepsy that actually causes them in a social embarrassment. When the fits occur in the public, then they begin to jerk and foam. An epilepsy doesn't actually respect the patient's and the patient's and the social standing. The fits can actually occur at any time, anywhere, and a patient can say he has had enough, that he wants to die. So or actually parents who actually suffer dementia, and they can't anymore recognize their their husbands, their wives, and their children. And then they start to, to actually behave out of out out of what's actually considered normal. No, at some point, the children can say, please, can come over to doctors and say, please give my parent an injection to end his or her life because the suffering is too much. So very many countries are now considering whether doctors should be given the right to end the life of a patient when the patient so requests. So that is the ethical and the procedure called euthanasia. Is it legal? Some countries have started to actually make it legal. Some countries have started to make it legal. Uh, uh, Certainly, it is not yet legal in Nigeria. Then there is the ethical issue of brain death. The patients in a coma. If you continue to wait first month, second month, third month, and a patient does not wake up from his deep sleep, and then maybe they have reached such a stage where they can no longer breathe for themselves, now then doctors have to continue to use a machine to help them to breathe. Who decides when to turn the breathing machine, the respirator off? Is it ethical for doctors to decide when to help a patient to stop living because he or she has been in, uh, in a coma and probably brain dead for a very, very long time? And I know that there's also the issue of an abortion. Okay, that has this has become an international issue. Should actually mothers, is it ethical for mothers to have the right to demand an abortion whenever they see that, whenever they see that they no longer wanted the baby? Some people say yes, that a woman has the right to decide what actually happens in her body. If she gets pregnant and she doesn't want the baby, they say she has the right to ask a doctor, please terminate my pregnancy. But the real truth is that, does any person have a right to terminate another human life? And then the people who actually argue for abortion say that, look, that particular baby has not yet been born and therefore he is not yet human. But how true is that? And then because now doctors, when we actually listen, we can hear the baby's heart beating. Dudum, 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 dudum. And then the baby also moves. So then, and therefore, at what age should we permit women to ask for their babies to be aborted? These are all ethical issues. The pro-life people say there is no room at all for any human life, whether pre-birth or actually during birth or post birth, can be terminated. Said there should be absolute and absolute ultimate respect for human life. Even from the moment the pregnancy test a positive, the baby's life needs to be protected. So these are are actually ethical issues that the politicians are now delving into. Politicians are now deciding what is actually ethical for doctors to do and what doctors shouldn't do. Should the politicians have a right to make laws that change how doctors practice? Well, the doctors, uh, if you practice within the framework of the laws of the land, you are also liable to practice according to those laws. So that where customary laws or laws of crime against the state determine medical ethics, I think they still have that to be respected. But there are many countries now that have used their constitutional powers to decide that it is a legal thing to abort babies. Are they not playing God? Can any man decide when another human life should start or should be terminated? Well, these are ethical questions that are being discussed for and against. Then there is the issue concerning cloning. And because as at now, in the genetic researchers, they have found a way to clone animals, just from one and a single cell. Once that they can get once they can get a string of genes from a cell or from a tissue, they can grow a new animal in the laboratory. Yes, they did not create the animal per se, because they did not create the cell that they cloned. But they have found how to actually develop a full animal from the cell. And now there is the ethical issue as to whether they should begin to clone human beings from cells. As an example, this means that now if it is approved, I can actually permit them to take one cell from my own body and now create people who look and behave exactly like me. How many of me do I want to exist in the same world where I am still living? So that is the issue, behind all the arguments against hybridization. Is it ethical? Is it not unethical? And currently, the researchers are not allowed by the laws of most countries, if not all, to actually clone human beings from cells and the tissues in the lab. Okay, but one thing that the doctors have actually started doing is actually the use of the use of an IVF, to actually fertilize eyes actually human and ovum, and then transport defertilized in the ovum and into the womb of a mother, and then the baby grows. So before the IVF started, it took a lot, and a lot of a discussion. But now it is now approved for doctors to actually conduct of the IVF and use IVF to make babies for women who are otherwise infertile. Okay, so or men, rather couples who are challenged with their giving birth, now they can have their own children through IVF. And in fact, even single ladies who have not actually been able to find any husbands, they can use IVF to have babies and to raise actually their own families as a single parent. So all these are all ethical issues. And then definitely in a clinical research, human subjects are not allowed to be used to test any new intervention, any new treatment. Test the new treatment using animal experiments first. Never test new drugs, new treatment on human beings. If you do, the police will come for you, because that is going to be regarded as a medical malpractice. And of course, talking about professionalism in your dealings and your relationship with your patient. Doctors are not allowed to actually establish any emotional, physical and a relationship with their patients. Whether the patient knows, whether the patient agrees, whether the patient consents, there is no how a doctor should become a sexual or emotional friend with his or her patient. And definitely, you must not ever have sex. You must not touch. You must never have any romantic dealings with your patient. Whether it is actually forced rape, or even if it is actually consensual, that the patient asks you to please do it, that he likes it, that she enjoys it. It is against professional ethics for doctors, and in fact even nurses too, to touch, caress, enter casual friendship, to date, to court, to marry, to rape your patient. If it is ever known that the woman that you married properly was your patient or is your patient, you have broken, you have crossed your professional boundary, and you are therefore liable to be carried to court and your license seized. So that all these are actually issues that you need to be aware of concerning medical ethics. So therefore, for these ethical principles to be policed, to be to, to be monitored. Okay, there is a lot of there is a lot of interrelationship between medicine and the law. So, and that is actually because, in a way, we need the law in the medicine, okay, for us to actually regulate it, and to regulate the ethical behavior of a doctors in their practice. We need law in a medicine to define and defend patient's right, patient's safety, patient's well-being. And we need laws that will define what exactly is a medical malpractice and a medical negligence. These are two things that I want to cover in this particular lecture. So, and therefore, the key areas of the legal sides of a medicine is that, one, and according to what we actually said, the law protects patients and defends patients. That look, patients, if they have the capacity to decide, their autonomy needs to be respected. If you don't respect the autonomy of your patients, and you don't respect their right to give consent, their right for them to actually tell you how you use their clinical data, you can be liable to be sued to court, and you might lose your license. Okay? Yeah. Then there is the concept of the medical negligence. The negligence is, okay, if a doctor makes any mistake, by virtue, or from whatever reason, and the patient now suffers from that particular mistake that the doctor has made. That is actually medical negligence, and the doctor can be sued to court. Okay, and it can be medical accidents, mistakes, or actually failure. For example, you can give a particular treatment, thinking that is the best as the treatment to help the patient, and the patient dies. You can be sued, not for malpractice, because you knew what you were doing, and you thought it would benefit the patient. But it is actually negligent because you did not find out all the information concerning that drug before you administered it. So the doctor can be dragged to court because of treatment failure. So all this, they are what we call medical negligence. And then there are laws concerning issues, like we said. So and so there are laws that have to be enforced concerning organ harvesting. That is a new thing now that we actually hear goes on now, and doctors are involved. Doctors are being used by the businessmen to actually harvest organ, particularly kidneys and the liver. No, and the kidneys, and the people have to, people can actually live with it one. At times, they actually kidnap people purposely to actually harvest one or both of the kidneys to sell to actually patients who are receiving dialysis because their kidneys have failed, and they are ready to pay millions to any person who can give them the kidneys for transplantation. So all these are all crimes against the state, and there are laws guiding them. And of course, there are laws that actually guide misconduct. So please note also the difference between the medical misconduct, the medical negligence, and then the medical malpractice. Okay, the misconduct particularly refers to the unprofessional behavior of the medical staff. Okay, when they begin to fight in the ward, when the nurses they begin to 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 actually physically engage with blows with patients in the ward, or to actually abuse, or anything that actually crosses ethical, crosses professional ethical lines. Okay, there are laws that can be enforced. And of course, there are laws that also should be enforced in the way doctors manage the data of their patients. So that these are the areas where actually medicine intersects the law. Okay, there are actually certain legal frameworks. Okay, yeah. Okay, there is a branch of law. This one is actually a branch of law called the medical jurisprudence. Okay, so this is a branch, and I think this is a branch of law. Okay, not a discipline uh, 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 in a medicine. No. So, uh, so it's a branch of law that really specializes in using using medical evidence, okay, to judge crimes, okay, and especially crimes against the human body. So some actually lawyers who actually specialize in bringing doctors, consultants, investigating medical cases to find whether the doctor is at fault in the way he actually managed his patient, and they drag them to the court of law to be judged. So and it is possible you have also heard about this particular time now, the branch of medicine called the forensic medicine. These are the people who actually dig for evidence that could have led to the death of a patient, or that actually could have led to a bad outcome. So they actually come around to start to actually sniff around to find and to find and actually evidence in the way the doctor managed his patient, just to be able to actually detect what the doctor should not have done that led to the death. So all this, and is actually the way you apply the medical knowledge to judge legal cases is the field that is called in law medical jurisprudence. So definite legal frameworks exist that the doctors can use. Frameworks to guide ethical and patient care. And remember those 4 core principles of medical and ethics. It is a framework. It is something every doctor can easily remember. Beneficence, non-maleficence, justice, and professionalism. Because all this, if you cross ethical lines concerning these 4, you can be dragged to court. Therefore, it's a legal framework that you can use to guide proper medical practice. The framework also exists for the informed and the consent. The fact that you need to actually respect their autonomy, and the capacity rights, and of course, uh, uh, and, and, and of course, confidentiality. So all doctors have these legal obligations. Therefore, all doctors must act with honesty and integrity. All doctors must be open. If things go wrong, don't hide things. All doctors must protect and promote the health of patients and the public. All doctors are legally obliged never to unfairly discriminate against patients or colleagues, because that goes against the justice ethical principle, the justice principle. And then all doctors are legally obliged never to abuse patients' trust. The patients come to you at the most vulnerable time in their lives, when they are sick, when they are weak, when they are in pains, when their minds are all over the place and they cannot think right. That is not a time for you to start talking to them about love or actually dating or anything that is not directly concerning their medical care. If you abuse their trust and you exercise your power as a doctor over them, you are going against the legal obligation, and you can be dragged to court. So, yeah. So doctors, therefore, can face charges for gross negligence. Doctors can face charges. No, no, they can be declared criminals if a patient dies in their hands, and then they will be charged for manslaughter. They can be charged for professional misconduct, which is also called reckless as a behavior. they can be charged for euthanasia. If a patient says, "Now kill me," and you agree to do so, and I believe also part of this, that if a patient tells you to remove my pregnancy, and you do not find any medical reason to do so, but you abort the baby anyway, if it is against the law of your country, you can be charged for that as well. And then if you withdraw life as a support, okay, when the patient can still live a few more days because of it, you can be dragged to court by the patient's family. So all these are actually things you need that every doctor now considers. So for doctors to prevent being dragged to court, there are 4 ways that they are advised to practice their to to practice their medicine properly. Okay, malpractice means improper practice of medical care. Okay, and then to avoid you contravening professional standards, 4 things is that the doctor needs to act with compassion. The doctor needs to communicate clearly with the patient. And the doctor needs to be competent, okay, and have vital medical skills that will help the health problem of his patient. And 4, the doctor needs to chart everything he does. That is why when you go over to the clinic, to the hospital, you see doctors, they are always writing. And actually over here in the UK, they actually have their laptops. You actually see them always typing. You are talking to them, they are typing. They are charting the record, so that if anything goes wrong, there will be data available for lawyers, for and for the people, for the investigators to examine, to determine whether you have practiced well or badly. So that it is believed that these are 4 key things every doctor must do to avoid medical malpractice. Provide medical, practice your medicine with care, with compassion. Communicate clearly with your patient and then his or her family, and with your colleagues as well. And then make sure that you are properly trained. Train yourself. Acquire the skills. Be competent. Update your medical knowledge. That is your own responsibility. And then record everything you do. So I think for us to now begin to end. So common example of malpractices where those 4 steps are not ahead is when a doctor misdiagnose, which means when a doctor gives a wrong diagnosis and a patient suffers and dies as a result of that. you can be sued to court because it shows you are a quack. You are not you are not competent. And then when you delay in a diagnosis that has now delayed the treatment, and then the patient dies because the treatment was not started on time, okay, you are liable to be charged with medical malpractice. Surgical errors, where you should, that's an example, remove one kidney, then you go to now remove the two, or actually where you should cut the appendix, and then probably then you now go on to remove the entire pancreas, and then the patient begins to suffer, thinking you only did appendicectomy, not knowing you actually removed something else. It is medical malpractice. Also, when you have a failure to treat, you know what the patient needs to cure him or her, and for whatever reason you failed to give that particular treatment, it is malpractice. Also malpractice if a child suffers actually injuries during birth, and particularly doctors or midwives who actually use uh, 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 who actually use head clamps. No, there is this big forceps that they use to actually deliver babies. No, where a woman doesn't have the strength to push and the head has already come out, they often put this clamp, no, under the baby's head to now push it out. If they press it too much, the baby's skull can be crushed, or the bones can break, the leg, the hand. So all this, if it can be proven that the injury happened during delivery, all those people who attended to into the birth of that at the baby will be sued to court. Prescription errors, and particularly in Nigeria, where they practice, where actually very many doctors as their practice is a polypharmacy. And the polypharmacy means they actually over prescribe because they want to sell their drugs. No, where they just need to give just only Panadol, you actually see them prescribing Panadol, aspirin, ibuprofen, all sorts. Then they now add a multivite, to encourage, because that one has red color, yellow color, all to make patients spend more money. Or if you do not prescribe accurately, the antibiotics that you should prescribe for actually 5 days minimum, you now prescribe it for just 1 day and 2 days, and that patient develops antibiotic resistance and he dies. Once they see that the fault is from the prescription that you gave, you will go to court for it. And then those of us who do surgery, we also give anesthesia. Okay. Errors. If you give overdose and then the patient does not wake up after surgery, no problem, you don't land. Okay. Or if you give underdose and the patient is now crying all through the surgery, crying, I am feeling pain, and you continue the surgery, the patient will sue you to court for actually causing him or her unnecessary pain. And of course, a failure to prevent or treat. So all these are all medical malpractice. And the negligence is actually similar, but it is defined by what we call four Ds. If you breach your duty of care, that is medical. That is actually negligence. And then if the breach in your duty of care shows that you deviated from your duty to the patient, that is medical negligence. And then if it can be proven that particular breach in your duty of care that actually resulted in your deviation of the duty that you owe the patient caused any damage, or practically saying if any damages occur, okay, it will be regarded as a negligence. And now, if the damages occur can be proven to have resulted from the breach in your duty of care, if a direct causation can be proven in court, then then you will be sentenced that yes, you have been medically negligent in the way you cared for the patient. So that when we talk about medical negligence, remember the 4 Ds: duty of care, deviation from care, the damages from a care, and then direct causation of the damages from the breach of your duty of care. So you will be liable to be dragged to court. So therefore, for a legal case of a negligence, you must be able to prove all 4, not separately. All 4 elements must be determined in the case. Okay? Now the lawyers, the advocate must be able to prove, the prosecutor must be able to prove that yes, there was a duty of care that was breached. Okay? Breached means that the doctor deviated from the duty of care, and that there were resulting damages, because of that breach. Okay, and then if the causation of the disease, disability, and death can be linked, okay, to the breach, so the judge will say, bam, the case of medical negligence has been established. So, so definitely the negligence, again, these are the common examples that can happen from a breach of a doctor's duty of care to his or her patient. Again, they are all common, similar to the list that we gave for malpractice. The only difference is that these ones, if they happened as a result of a doctor's breach in his duty of care, then they are called medical negligence. so that it is just good and for you to know the difference and the means diagnosis, the delayed diagnosis, the surgical errors, the medication on the mistakes from the wrong on the prescription or the over prescription, the bed and injuries, and then the last ones in the hospital acquired infection. Okay, and I think for this and a particular one, if a patient that did not have a particular infection should go to a hospital, and then the patient now develops a new infection in the hospital that he did not bring from home. No, the doctors and the entire medical team, they will be dragged to court. Where did this new infection come from? No, it actually could have come from the doctor himself. The doctor may have been sick before carrying this infection in his own body, and he transferred it to his patient. So he will be drawn to court uh, to face a charge of a medical and a negligence. So I think this is where we end, unless if you have any questions. So do you have any questions? So that this is the lecture on on the medical, on the ethical and legal considerations in medical practice. So, and definitely, for those of you who are not doctors, but you are health workers, and I tell you that the same ethics also applies to you in the way you practice your health, your health profession. There is no way these cases will actually happen inside the medical ward, and then only the doctors will be arrested. No, they will arrest the nurse, the doctor, the ward orderly, all of them. Any patient that dies under their care, I tell you, it is not only the doctor who answers for it. Every member of the medical team, they will all answer. If things go wrong and if they don't practice their profession according to ethics. Any questions?
Not from my end, sir.
Okay. That means you understand everything I have said.
Sir,
Yes, sir.
Okay.
my question is that the slides itself, because there are times that I want to read, and what I find is the summary of class of what we had in class. There are times it's not as detailed as if we had the slide and I'm able to go through the slide, maybe read more on the slide. Sir. So I
Okay,
don't know
fine.
if you can share the slide with us, sir.
Okay, fine. I will. Yes, I will. Okay. And yes, I will. And thank you so much, then, everyone. So,
Thank you, sir.
and tomorrow will be your last as a lecture. So, and basically, what we need to have to discuss tomorrow is about how you write uh, uh, an academic paper. Okay, so the step by step as to how we write reports, articles, and such academic stuff is what we'll cover tomorrow. So, in the tomorrow zone, what time is it? Is it at 9 a.m., Abi?
I'm
Yes.
trying to check.
And I think it is in the morning, 9 a.m.
Okay, sir.
Ogna, see you tomorrow then, everybody.
All right, sir. Thank you so much, sir.
Bye. God bless you all.
Yes, sir. Yes, sir.